it's education, it is training in sets of tools for collaborative communication by bringing, a culture of conflict engagement rather than conflict avoidance, and recognizing that conflict may be a tool for good and for growth and for improving quality and patient outcomes and job satisfaction for hospital employees, that we can, sort of enrich the experience.
The Center for Understanding in Conflict welcomes you to The Other Chair, a monthly podcast exploring the dynamics of conflict and how to bring the human issues to the table. Together with our guests, we explore how the power of understanding each other can lead to better solutions for people on both sides of an issue. We will also share tips for managing your own mediation practice, approaching conflict in the professional world, and ways to apply our understanding-based model in your personal life. Hello to our listeners and welcome to The Other Chair. My name is James Dykeman. Today's guests are Doctors Paul Natterson and Jeff Stuart, physician leaders and executives with formal conflict resolution training, advocating an institutional framework for collaborative problem-solving techniques, including mediation, to positively affect dispute outcomes and create a more transparent and supportive culture in healthcare settings. In this episode of The Other Chair, Paul and Jeff join us to discuss the need for new approaches to addressing conflict within the healthcare system in America and how the understanding-based approach and other models of mediation are helping them to pave the way in an industry where conflict resolution is rarely considered or utilized. Hello, Dr. Natterson and Dr. Stuart, and welcome to The Other Chair.
Thanks. We're happy to be here.
Happy to have you. Very interested to hear more about the work that you're doing. And before we get into that, I think it'd be helpful for our listeners if you two would like to introduce yourselves so they know who's responding to the questions.
I'm Jeff Stuart. I am an anesthesiologist by training, have been in various leadership roles over my 30-year clinical career, including roles leading medical staff or physicians, as well as administrative roles within the hospital, as well as being on some boards of facilities in the healthcare industry, and have, as I said, been in practice a long time. In my course of my leadership, I've seen a lot with respect to all sorts of stuff in healthcare, and currently still practicing, but post some of my administrative work, but really focused on trying to make a difference in this area now of addressing conflict more productively in healthcare.
And I'm Paul Natterson. I am a cardiologist in practice, also for about 30 years. And while in practice, I've also had the privilege and the pleasure of working in different administrative roles, ranging from hospital chief of staff to managing partner of a large physician practice to sitting on a health center board, and also to working as a chief medical officer in a hospital. So like Jeff, I've had the opportunity, while maintaining clinical practice throughout, to also experience different roles in administration and leadership that have exposed me to sort of some of the wonderful things and some of the challenges that exist in medicine, including conflict.
Thank you, Paul and Jeff. And if you don't mind, I'll refer to you by your first names for the remainder of our program. I'm not sure who the best person to ask would be, so I'll leave it to you to both answer this question. What was your motivation for putting together a formal approach to resolving conflict in the healthcare setting? Was there a trend or a theme that you saw develop, or is it just generally a lack of tools in coaching when it comes to this in the healthcare arena?
I think Jeff and I both arrived sort of at the recognition that there was a gap or a challenge in our respective hospitals and health centers, that we, having been active clinicians and having served in many different roles across a health system, whether it was medical staff leadership or hospital administration, we saw how, even though, those of us in healthcare, whether physicians or administrators or nurse leaders, we all share a common goal of, caring for patients, that just like in any organization, there is going to be conflict, and to pretend that it doesn't exist is a real problem. So together over the last 3 or 4 years, really since the pandemic began, and we were both hospital chief medical officers. We've been sort of sharing our thoughts on the challenges that we've both been facing and realized the commonalities that exist in different hospitals, and that there was a wide open space for helping to create tools and pathways to manage conflict more productively.
In my experience, specifically when the pandemic arose, it unmasked a lot of things in healthcare. And I think things that had been issues in the past were magnified under such great stresses, and healthcare was already moved to the point where over my career I had seen all the pressures of now, burnout, staff shortages, increasing demands by patients and the organizations themselves, of everybody that's working with them, created a much tenser atmosphere than even had existed in an already tense atmosphere prior in my career. And that in my many leadership positions, I found that often in some of the biggest issues that we were dealing with, there was a lack of communication and communication skills, and specifically conflict communication skills, the ability to communicate under tension, that really made what we call a task or a conflict over a certain issue evolve into relationship conflicts, whether it's between individuals or groups of people, one nursing unit versus nursing unit, et cetera, one part of the hospital versus another part of the hospital. And from what I saw in my experience, the mechanisms for dealing with conflict were extremely reactive, and they either were three paths essentially: non-active by avoidance, which is really the primary approach to conflict from everybody in healthcare, unfortunately, or would, if it involved employees, go through the route of human resources, or if it involved medical staff, it could go that way, but along with going through various medical staff official processes. So it immediately got ramped up to this more authoritative approach, and there was really nothing in between that could, number one, mitigate things going to such a high level and creating such increased stress, creating costs, wasted productivity, et cetera. And number two, there was nothing that existed that could mitigate this or kind of nip it in the bud. The skills didn't exist among really anybody, essentially, because there were so few people, if any, who were healthcare practitioners themselves that also had any conflict training.
So this sounds familiar. When the Center for Understanding and Conflict and the Understanding-Based Model was started in the early 1980s by our co-founders, Gary Friedman and Jack Himmelstein, there was very little in the way of an understanding or an appetite for these sorts of conflict resolution tools in the legal community. And when I hear the two of you introduce your work and what you've noticed in the healthcare field, it sounds like you're in a similar place where there's a very large need, and that need has a lot of economic and social consequences. What sort of feedback have you gotten so far as you've begun to explore this as a possibility? And then I know earlier at the beginning of this year, you formally founded your firm RX Solve Conflicts and published an article about managing conflict in healthcare. What have those first steps been like as you go into this field?
Yeah, I would say first, as far as the feedback we've received, has been quite positive. It's definitely something that resonates with those of us that are working um, on the ground in healthcare, and whether we're in administrative or nursing or medical staff roles. And what's interesting is it's one of these issues that it seems like it's so obvious to people that there's a problem, but nobody's ever been exposed to alternate routes to dealing with it. So it, I think, in a lot of ways, validated both the fact that everybody is, in various roles, is aware that this is something that's really stressful and kind of sucking the wind out of them in a lot of ways, in their relationships with others, which were already strained and yet more strained, as I said, during the pandemic. And really a lack of awareness of what could be done differently. And we undertook writing the article with the goal of sort of introducing or kind of declaring this, our realization of this, and how in our various roles, which we describe as having kind of a 360-degree view of all the possible relationships and interpersonal and interdepartmental dynamics, having been on the medical staff, the administrative staff side as far in leadership, and then being clinicians and also being on the boards of organizations, that there were, just like in with respect to a lot of other issues in healthcare, things were siloed and people didn't really understand each other. So the fact that we both had some experience and some success based on our own, I think, just inherent skill sets, which turns out we undertook formal mediation training and realized this could almost supercharge, if you will, our ability to try to make a difference. And we're really just trying to write an article to kind of introduce, again, educate people with clarity that what the problems are, even though they seemed obvious to them when we would bring them up, and introduce the concepts as far as there are probably better ways, or definitely better ways of dealing with conflict that again, most in healthcare, because they haven't been exposed to them, are not even aware of.
And as Jeff and I were sort of sharing our common experiences over the last several years and started to put together things more formally, we learned that, as an example, the Joint Commission, which is the organization that oversees quality at all hospitals, had in 2009 put out a leadership standard that's supposed to be implemented in hospitals across the country, where there's a formal dispute resolution process embedded at the institution. And while those may now exist in hospitals, on paper, what we experienced is that, perhaps it was more lip service to achieve sort of the appearance of having sort of an embedded program, rather than really doing something to change the culture at the institution. So there's an imperative to do this, and it sort of reinforced to us that this wasn't just our own experience, but it really is something that is systemic and necessary, really everywhere in healthcare. And to be even more specific about sort of the response that we've seen, certainly healthcare administrators are very excited about the idea of sort of a cultural shift to recognize that conflict is not bad. Conflict exists and can be a tool to use for good. And the other, which was sort of surprising to us, is attorneys have been wildly enthusiastic about the idea of having physicians who have experience in conflict resolution become involved in the disputes that they are looking to navigate.
Jeff, you mentioned formal mediation training, and I know that you, Jeff, have taken some training with the center in the understanding based model. How does the understanding based approach to mediation uniquely address the complexities of healthcare conflicts as you've encountered them?
Well, one of the most interesting things I took from my training, as far as what can come out the other side of utilizing the understanding based technique, was uh, this concept of the ability to strengthen relationships between people who come into something in serious conflict. And nowhere is that more important than
Conflict
in
manifests
healthcare,
itself in
where
many ways in
our
our personal lives.
disagreements
For
are
professionals
not
in the
necessarily
workplace and for practitioners
transactional.
who have made a career bringing
They're
together
in the
parties in
ongoing
conflict through mediation
process
practice.
of our daily
Each
work,
month, the
because
Center for
tension
Understanding in Conflict
as
hosts live
is
webinars with
allowing
featured
tension is
guests
not a
discussing
problem
best
in
practices and
healthcare, because it
sharing their
already
experiences in
exists. It's a
tackling
matter of
conflict
how
using
we
the
manage it.
understanding
So
based model.
the way I felt like the key benefit of using an understanding based approach was the need in healthcare to be able to continue to work with these people who you can be having conflict with, and the possibility of going through such a process, you would deepen the relationship and improve teamwork and improve um, the smoothness of the operation for both you and your patients. And when I think about some of the six underlying concepts we learned in our training, a couple really come to mind that are extremely relevant to what our approach is in with respect to conflict in healthcare. And the first is the concept of going beneath the problem and trying to understand where others are coming from, and kind of creating this opportunity for more collaborative solutions as opposed to just focused on what your position is and I need this and you need that. Because so often in healthcare, folks are just really trying to do their job. They're so dedicated. It's such a hard job for everybody. And a nurse or administrator might be trying to do what they feel is right because that's what they've been tasked with doing. A doctor's been tasked with doing their job. And while the goals may intersect, they may not be exactly the same. And yet conflict can ensue without one side really understanding where the other side's coming from. I saw productivity come out of these kind of interactions and going beneath the problem during the pandemic, because counterintuitively, maybe one of the benefits was the need for true transparency among everybody and what drove their decisions and what was important to them. And that really laid the framework for win-win situations that we wouldn't come up with otherwise.
And Paul, I understand that you trained with a different model and find some value in the shuttle mediation or caucus mediation. Please talk more about that.
So I think I had the experience of being educated and trained in, as you said, the shuttle diplomacy or caucusing, where the two parties are uniformly kept apart during the mediation. And what I've learned over the last several years working with Jeff is that many of the fundamentals that Jeff has taught me about the understanding based approach is used in the caucusing approach, but a little bit differently. And the my sense has been that early on, long before uh, disputes or conflicts reach a stage where you're getting close to potential litigation or third party adjudication, that the putting parties together and actually sharing thoughts and letting people understand the other's positions in a more understanding approach is a fabulous tool. And I think the caucusing seems a later stage approach where there's perhaps some of the hostility or anger or issues have reached a point where it becomes less productive to have people together.
Can you give our listeners an example of a common conflict scenario that one might find in a healthcare environment?
I can give an example of a situation that arose not so long ago at my hospital, where an individual who is a highly skilled physician had a behavioral issue that was a recurrent challenge. And like I think Jeff and I have seen this repeatedly, the the standard approach when there's just to give a little bit of background, when there's a behavioral issue in a hospital, often the medical staff is charged with overseeing sort of the quality and the disciplinary types of actions that are undertaken. And what often will happen is that when there's a disciplinary action, there may be a suspension of medical staff privileges. And as soon as that happens, even as we're sort of sorting through what the issues are, lawyers are brought in, people dig their heels in, and often once that happens, the communication breaks down immediately. And the communication starts to move strictly from one party to its lawyer to the other party's lawyer and then back to the other party. And there's very little direct communication and almost no effort, it seems, to understand what the actual interests are of the individual or of the medical staff, for example, rather than what their positions are.
RX Solve Conflict is working to help medical communities move from a perfunctory approach to a proactive one to help our listeners understand how you've gotten started.
So we did do a training at my hospital, actually. Um, I partnered with another healthcare conflict specialist. She was an attorney, um, not from the understanding-based school, but has an approach quite consistent with the understanding-based school. And she and I
Throughout the
together
year, the
brought our
Center for
own
Understanding and Conflict
perspectives, kind of
hosts
like Paul
in
and I,
depth
to the
basic and
table.
advanced
And
certificate
so really
programs
felt
designed
like
to train you to become
this was a
effective
great
mediators
opportunity
and
because
conflict resolution
my CEO
professionals
was
centered in the
quite
understanding based
interested in
model.
us doing it. And
Our
we
training programs have been the gold
did
standard
it
in
with an
alternative
approach of
dispute resolution for
kind of
40
addressing
years and
the
is
new
popular
kind of
within the legal
generation at our
community, with
hospital of
human
medical
resource
staff
professionals,
leadership. So the
ombudsmen,
younger
and corporate
doctors who were
workplace
just coming
mediation
into
clients.
leadership, understanding how, I was just, and Paul as well, just thrown into the fire and kind of learned these things over time and just happened to have the skill set to be successful. And so that's really where we started. We really feel like right now we have also done some, have connected to some law firms with respect to trying to you have them, if the need arises, utilize our services to help them manage conflict between physicians. Us being physicians, we feel like that is something where physicians who have been on all sides of it well positioned to do. We really are trying to our next steps with respect to kind of education and again exposing people to the idea is trying to do some talks for various medical organizations and within hospitals where we've our network has taken us, trying to do some education, facilitating some retreats. We have a retreat plan this fall with a medical community of 3 hospitals in Southern California, which is having challenges between their governing body, their board of directors, and their medical staff. And so this is where we're starting. We have not been called in to officially mediate anything at a hospital yet, but again, we view kind of our services as a continuum, and this is how we would approach, I think propose the conflict we manage in healthcare in general as a continuum of education, training, facilitation, coaching, all the way up to formal mediation. And interestingly enough, sort of a seminal paper on conflict in healthcare and hospitals was written not long after the leadership standard came out by somebody, by Deborah Girardi, who was a nurse who became an attorney UCLA, who is still towards the end of her career, but still active, and Charity Scott, who unfortunately has passed away. They're both excellent with respect to conflict and great writers. They wrote a 2-part article that was published in the Joint Commission Journal about a strategic approach to managing conflict in hospitals and proposed this framework of kind of this continuum of conflict management within a hospital. And part of our motivation of writing the article, again, going back to that and trying to make a difference here is because it all made so much sense to us having had our experience and our training in this area. It's such a logical next step to kind of how we can do better. And yet it was just been incredible to us and nobody's picked up the mantle on that and taken it forward. So we're trying to do that in their stead. And, we've taken some first steps and look forward to taking more.
How about you, Paul? Anything to add?
It's a multi-pronged sort of 360-degree approach, that hopefully, formal dispute resolution itself and conflict resolution, whether it's mediation or something that is third party adjudicated, that you don't even need to ever get there, and that by bringing a culture of conflict engagement rather than conflict avoidance, and recognizing that conflict may, as we said earlier, be a tool for good and for growth and for improving quality and patient outcomes and job satisfaction for hospital employees, that we can, sort of enrich the experience. Um, so as you pointed out, it's education, it is training in sets of tools for collaborative communication, and then individual coaching. And one other thing that we experience, both of us, is that so often in healthcare, people are when it are thrown into jobs or new roles as leaders, whether that's chief of staff or whether that is an administrative role, where you may have spent 5 or 10 years in your medical training and then you're practicing, but then suddenly you become a medical staff leader, but have never had any formal training in really what that means. And part of what it is required is communication skills, listening skills, empathy, and so on. And so we see a an opportunity to help people in these roles share their experiences and grow from one another by having sort of peer forums with chief medical officers who can confidentially share experiences and can grow from one another, for chiefs of staffs or chief of staff elects, to so that when they're in this role, they don't feel like they're alone and isolated on an island. And so there are lots of ways that we see um, opportunities to improve as we said, the experience of the people providing the care, and hopefully that really results in improvements in care.
You mentioned a couple of times something I have to ask you about, and that's culture, because I think providing tools and education is one thing, but one of the key parts of leadership that probably is the hardest thing to affect. It takes the most amount of time and a deep understanding, and ideally consultation with those who know. Is changing culture or affecting changing culture? Can you talk a little bit more about your experience with that, and what do you share with, or how do you approach those who are looking to learn from you on how they can implement, a positive, a conflict positive culture at their medical centers?
Well, I would say that
This
there's this
podcast is
concept, a lot
supported
of
by
people
our
in healthcare are
CUC
aware of
Connect
it, and maybe it's
members,
even
whose
outside
yearly
of
membership
healthcare.
includes
So
free
in,
attendance
in
to our
the
live monthly
world of
webinars,
healthcare
12
and
additional featured
hospitals,
recordings of
of
past training
creating a
events,
just
and
culture. There's
support
been a
from our
lot of
network of
work on
certified
that where
trainers for continued professional
people
development. Consider
feel
joining CUC
confident
Connect
speaking
today
up
and dive
regardless of
deeper into the
their rank or
understanding based.
level, and that we're really trying to create a culture where there's respect for everybody in that way, and resulting in better patient care, better, improved wellness for all of us involved. And what I have found in, my experience is there is a lot of talk about that, but there's no way of accomplishing that, again, in my opinion, without addressing this missing piece that Paul and I are trying to address. I think we going back to my discussion about the pandemic, and it may be kind of counterintuitive to many, as challenging as it was, we sort of grasped that culture briefly because everybody was on the same page. Everybody was transparent about what they thought. Doctors listened to nurses who were on the floor. Nurses listened to administrators who might have information on supplies, and nobody felt like they knew more than others or that they were afraid to speak up. And again, I was very disappointed that we sort of withdrew back to our prior ways after the stresses of the pandemic eased. And to me, it's an example of what is possible. And I think that it is so hard to change culture. I think that, I really, when I was on the executive side, tried to um, stress the importance to everybody of the things we've been talking about today, is understanding each other's interests, and that if we really want to have a just culture, we can't just talk about it, we really have to do the hard work to train people and be able to execute it. And I think the situation is ripe for it because we need it, and I do think everybody wants to do it. But our silos of existence in healthcare, which were temporarily broken down during the pandemic just by need, have sort of cropped back up, and it is. I'd be understating it if I didn't say it's a huge challenge. There's no doubt about it.
And I would add that, sometimes it becomes, it's so daunting, the idea of changing culture, but we have made big strides in healthcare since Jeff and I, not the two of us haven't made the strides, but healthcare as an industry over the last 30 years. I mean, you think about what goes on a medical ward or in an operating room, and how even just a few decades ago, these were exceptionally hierarchical and vertical structures where you had a surgeon who was really the captain and the final word, and and the same took place on a medical ward with the attending physician. Now it's recognized that the nurse or the scrub technician in the operating room may see things that the surgeon doesn't see, and not only is empowered but really is expected to speak up and be a patient advocate without fear of retribution. And so we do see this, and it is good for patient safety. It is good for culture. It is a step forward, and it can happen. And we'd like to see the same thing happen with regard to the challenge that we're talking about.
Well, thank you, Paul and Jeff, for being here today to talk about your work advocating conflict resolution and mediation practice in healthcare settings. It's truly inspiring to learn about your journey and to hear from identifying a need in an environment that isn't accustomed to approaching it the way that you're trying to approach it, to forming an organization, and then working hard every day to bring together patients, providers, and leaders in conflict. Thank you so much for being here today to share your work.
Thank you very much, James.
Thank you.
Dr. Natterson and Dr. Stuart are co-founders of RX Solve Conflict, a firm committed to achieving healthcare excellence through constructive conflict management. Learn more about their approaches to addressing conflict in this setting and how the understanding-based approach is well suited and needed by visiting www.rxsolveconflict.com. Thank you to today's guest for being with us today, and to our CUC Connect members whose support enables the Center for Understanding in Conflict to bring new perspectives in the field of conflict resolution and mediation to you, our listener, in each new episode. You can find out more about today's episode, along with full interviews and additional information about conflict resolution and mediation using the understanding-based model at www.understandinginconflict.org.